regularly scheduled meeting, Snap and WIC Enrollment. Thanks for being here. I would like to go around and do introductions and make sure we include our folks on the phone. So we've got everybody, meeting everybody else who's here, because there are lots of folks coming out and new people, and would love to do that. So if you, we've got a pretty full agenda, so I think we will do a lot of familiar stuff today. So we've got some great presentations, so I don't want to take any time away from that. So just share your name, your affiliation. If you want to say something about yourself or your role, please do that. I don't want to limit it, but I just want us to spend some time on that today, given our agenda. So my name is Cindy Willard. I've been facilitating with the WIC for some time, so welcome. So it's great to see everybody today.
Cindy?
I'm providing communication support to the WIC.
Yes.
Do we want something on the phone?
Yeah, I'm having a really hard time hearing you, but I hear a whole lot of loud shuffling of paper.
Got it. Okay.
Nobody move their paper. Let's get this dialed in.
Everyone sit very still. We will try to resolve that. So given that that's the case, let's go to the phone first and see if we can get that managed. So I see a couple of names and a couple of phone numbers. So Michelle, would you like to introduce yourself?
Sure. My name is Michelle Trujillo, and I'm the Economic Assistance Division Director with the Mesa County Department of Human Services.
Great, thank you. Looks like Maureen Alexander.
Hi, this is Maureen Alexander, and I'm one of the administrators with Community and Child Support Services in Arapahoe County, and I'm actually sitting in for Kathy Smith, and she should be joining the next meeting.
Great, thank you. Sarah Robinson. If possible, you are on mute.
You are on mute.
You are on mute. It's like it's blinking on and off, which I have never seen before. So I don't know what that means. There you go. Now it looks like maybe. And no. So we'll come back to you. I'm looking at a phone number, and this may be someone, but I'm going to read out. So 9702.
That's Michelle.
Is that Michelle? Are you 248-2736?
Yep, that's me.
Okay, perfect. Thank you. We have a 303-880-7788 number.
Hi, this is Rebecca Dubroff with the American Heart Association.
Hi, welcome. We have another 303 number, 636-1100.
Hi, this is Rebecca with HICFA.
Hi. And then we have 303-489-5497. No. We did, but we're not hearing anything. Okay, let's try Sarah again and see if we do have any luck.
Sarah Robinson, Mesa County Public Health.
Great, thank you. And then our 303-489-5497 number. Okay, well, we'll come back after we do in the room. So Michelle and I have introduced ourselves. Hopefully we've gotten our sound stuff regulated here. Khadijah, you are up.
Thank you. I'm Khadijah Haynes, and I am a consultant to the project to address inclusivity, diversity, and equity.
I'm Heather Benninghoven from BDT, program coordinator for all of our Colorado work.
Elisa Zigmont, also with BDT. I'm the director of programs formerly. I've got a new role that I've not quite started yet, so.
Can we make sure that you're saying what these acronyms are?
Sure, Benefits Data Trust for BDT.
Carrie Jason with the Colorado Department of Human Services. I'm the SNAP Program Manager for the state of Colorado.
Hi, I'm Anya Rose with Hunger Free Colorado. I'm a policy analyst.
I'm Sarah Lipowitz, Colorado Center on Law and Policy. I'm the new public benefits advocate.
Brett Reeder, Director of Client Services for Hunger Free Colorado. I'm Jack Regenbogen, attorney and policy advocate at Colorado Center on Law and Policy.
I'm Quan Atlas with case issues and ID framework.
Hi, Sarah Mondry, filling in from the Colorado Health Foundation, filling in for Alexis Waitman.
I'm Erin Kendrick with the Colorado WIC program, the Colorado Department of Health and Environment. I'm Jackie Pines, and I'm here with Family Resource Center Association.
And Sandy Sunmark, Department of Pediatrics.
Gabby Warner, Blueprint Project Manager for Colorado Department of Education, standing in for Amanda Mercer, who's on leave for a couple months.
Kendra Stricker, Trailhead Institute, for helping facilitate Blueprint. So if there's anything we can do to help, just let us know.
Jennifer Banyan, I'm the CEO of Our Evolution Consulting, and I've been the primary strategic consultant before, during, and now with the Blueprint.
I'm Kevin Warner. I'm with Trailhead Institute.
Great. Thank you all for being here. This is great. We've had great turnout the last couple of meetings, and we appreciate you being here today. We had discussed in our last meeting selecting chairs for each work group. We had some discussion last meeting, and I think we have some resolutions for this meeting. Are we announcing that, or are we not announcing? Is that okay? I'm going to look down the table.
Yep.
Okay. So Anya and Jack have agreed to become the co-chairs of this work group, so thank you very much for taking that on. I understand that that's not a bit of in the future when you will formally step into those roles, but thank you for agreeing to provide that leadership to this group. I think that's great.
But we'll expect that in May, and you'll get as much support as you need in the transition. So we'll just keep as is until then.
Which is one meeting.
Yep, exactly. I think we can swing it.
So that's the upside. So today we are continuing with the work that we started last month in highlighting some of the work that's happening in the space related to this work group goal, understanding some of the things that are in process and some of where we might have potential to build on. And so we have 3 folks who are going to share with us today, and so I am going to turn over to those folks to share some, oh no, you know what, sorry, I'm getting way ahead of myself. So there was one other thing we wanted to do today. Kevin sent out an email this morning, and we have information, he's holding up.
Yeah, I can share it on the screen here.
Fantastic. Sorry, there is a letter accepting comments on some SNAP information that's going out. And I am not the best person to talk about that, so I'm going to look at maybe Jack and Anya to talk about that. I know Hunger Free has been really helpful in putting together some of the materials for comments. We sent around the letter that Alexis had started, hoping folks would sign on, but Anya, can you give a quick recap of what we're asking of folks, please?
Sure. So the federal proposal right now that would reduce the flexibility that states have to request waivers to what's known as the ABOD time limit for SNAP. That stands for able-bodied adults without dependents of the population of childless adults between the ages of 18 and 49, who are typically exposed to a 3-month time limit, meaning they could be on food assistance for 3 months in a 36-month period, unless they comply with certain work training requirements or work an average of 20 hours per month, and are able to demonstrate that to the administering office. However, states can request waivers for areas, or in some cases entire states, depending on the economic reality at the time. So in areas with too few jobs or really high unemployment, you can request a waiver based on certain criteria. What this proposal does is it limits that criteria and some of the data that could be used to request waivers. So nationally, it would expose, the USDA estimates, about 755,000 people to the time limit taking away from them. So there's a national effort to submit comments because it's a regulatory proposal. So the deadline to submit comments is April 2nd. And I think Alexis put together a blueprint comment that folks can sign on to, but it's also really important that organizations file individual comments as well, because any unique comment will need to be responded to before a final rule can be implemented.
Great, thank you.
So yeah, definitely submit your own unique ones, but if you'd like to have your organization's name added to the letter, just let myself or Alexis know by this Friday, hopefully is the deadline, so.
If you want, you can just get on your phone right now and tell them it's fine.
Yeah, absolutely. Yep. So two-part request, do you want to be on the letter? And please submit individual comments. And again, Kevin sent out a great message this morning that has all of that in it as a reminder for you. So if you're interested in supporting that, please opt in. Okay, now I'll turn it over to our groups who are going to share with us today. And it looks like our friends from Hunger Free are up first this afternoon.
Great. Kevin, where would you like us to?
You can stand wherever I can pull
Where's
it.
the microphone?
Yeah, this is the camera that's on. So actually, I can even trade you, and they can probably see you well from this here. I'm happy to do that.
Sure, yeah.
Actually, I'll go outside.
And you gonna drive and?
Yeah, or you could use this mouse and just give it a right click and tell me what the next slide up there works to.
Okay. Well, hey everyone, you all know Hunger Free Colorado pretty well. Probably you don't know me necessarily. I'm new to the organization. My name is Brett, and I'm the new Director of Client Services, which is really everything that touches directly our clients. Big part of that, of course, is SNAP and WIC. And that's mostly what we're going to talk about today. And y'all know soon-to-be co-chair Anya. She'll chime in here as makes sense. So super quick, just give you a sense of who we are if you don't know. So, you know, as an organization, we really view nutritious food as a basic human right. And we think that that's what it will take to really solve hunger. So, you know, throughout a lot of human history, production has been a problem. Haven't had enough food when there's famines and stuff like that. And that certainly still happens in certain parts of the world today. But for the most part in this country, it's not a production problem. We have enough food. It's just not getting to the right people. But we think if folks really view this as a basic human right, that we can solve that. And so, aligned with the blueprint, we want to end hunger in Colorado. And we think that means connecting Coloradans to food resources, including SNAP and WIC, but beyond that as well, so food pantries and other solutions. And we think it goes beyond just that direct service, so that's a lot of what we'll talk about today, but really change in policy systems and social views. So you see those 4 bits, and I'll talk a lot about collaboration towards the end. We can't do this alone. No one organization here can do this alone. We all have to work together to make this happen. So we're here to talk about goal 4, SNAP and WIC enrollment. And so while the whole story is of course much larger than that, that's where we're going to focus. What are we doing around that goal? And I'm actually going to kick this over to Anya, but ultimately we're going to be talking about this number 1 most of the time today. The step 2 is also important. So if we knock the ball out of the park in applications, but we're falling down in eligibility determinations, folks aren't getting those benefits. But I'll turn it over to Anya to talk a little bit more about that.
Sure, yeah, I think just based on past conversations we've had here, it's just really important to distinguish between what we're doing as application assisters or what applicants can complete on their own versus what actually happens in an eligibility determination and what has to happen in Colorado at a county office or with a county eligibility technician. So when we talk about applications, and because we will be talking about applications in the presentation, we're talking about sort of pre-screening, seeing if someone is interested in and might be eligible for assistance, helping them apply, referral to other food resources, and then we also do follow-ups on eligibility. But there are a lot of key pieces missing there that are required for someone to then actually enroll, kind of like Sandy talked about in her presentation with Kaiser, where there are all these fall-off points because it can be an arduous process. And that includes completing the interview, providing needed verifications. We can give people a heads up about what they're likely to need, but typically until a well-trained county eligibility technician does an interview, we don't know exactly what verifications are necessary, especially because we're not looking into the state benefit management system to see case notes. We don't have that access. So that's part of the reason that verification falls on that step 2. And then the approval and denial and actual issuance of benefits, all of that's going to have to happen at a county office. And those are all pieces of the process that we definitely are invested in. It's not exactly the focus of the application, but we wanted to mention it, make sure that's on everyone's mind as well.
Yeah, thanks, Sonia. So again, we're going to be talking about this step 1, but just recognizing that this is one piece of a much larger system, and to be successful, it's in part why collaboration matters so much. We need to be aware of step 2 as well. Great. So Hunger Free Colorado is got 3 strategies to approach this application piece. The first is our hotline. Many of you are probably familiar with that. And associated with the hotline are also referrals. So a hotline will take cold calls. People can just call that number right up there. But there's also referrals right now, primarily through the medical systems, where we'll get a referral in, and then we actually actively reach out to those folks. And that active outreach is really important because if we're not actively outreaching but waiting for people to call us, we get far fewer numbers. So that active outreach is really important. But that's one piece. The second piece is this mobile outreach. That's where we're physically going to locations, often clinics, but it could be Save Lots or any number of other locations. We got it set up, and we have a mobile outreach coordinator bringing folks in. And then we've got this partner enrollment organization. Sometimes you'll hear the term subrecipients. That term will resonate with some of you and not with others. Ultimately, what we're talking about is we're partnering with other enrollment organizations to support them in doing the same kind of work. For the most part, what those folks are doing is some version of mobile outreach, but they're the ones doing it. There's also an element of referral there too, though. So some of those folks are referring to our hotline. So we got those kind of 3 strategies we're approaching this application issue with. And this is what the numbers look like for the first part of our fiscal year. We run on a July to June fiscal year. What you see there are the dark purple is that hotline I was talking about. The light purple is the mobile outreach, and the orange are the partner organizations. So it's what you have over time, and then the black is total, so just aggregating that. A couple takeaways. One is that, I don't know if you can see here we are, okay. See what's happening to the orange there. So that's what you would expect, right, as people ramp up, but that's really important, in part because when you look at February, that contributed the most to our applications. So it's ramping up, but we think that's part of the solution here, is empowering other organizations to do this, not that we just take it on ourselves. You also will see a spike in January. That is directly related to the government shutdown and the specific outreach we did during that time. And then you'll see that the mobile outreach is relatively steady. We're working on expanding that, and we're doing that through staffing, but also trying to reach out into new areas, so new types of places. We got a pretty good presence in clinics, but we're looking at other types of places.
Brett, can I ask a question?
Yeah, absolutely.
So how many FTE are you having on mobile outreach, and then how many are on the hotline?
Well, it's a bit of a tricky question because it's not consistent over time, and that's one of the things we're augmenting. But, the only one of those that's certain is this partner organization. So we have a rural engagement manager who's full-time. She's going out mainly to the Western Slope, but working with our partner organizations. And then the food assistance program manager is also doing a lot of that work with the metro area. So like Mile High United Way and folks like that.
So it's like 1 or 2 FTE driving the mobile outreach and like 4 or 5 people driving the hotline, or what's
not quite that clean. What is fair to say is that the way we do business today, mobile outreach is more efficient at getting applications. So right now, the way we're doing things, it's a cheaper way to get to applications. And we'll talk a little bit about that.
Good enough.
Okay. Good. Now we'll talk about that. So we got those three strategies, and there's strengths and weaknesses to each of them. One of the strengths of the hotline referral is this geographic reach. So because we're not physically someplace, we can take calls from anywhere across the state. We also have some flexibility in timing. While our folks are only there from 8 to 4:30, they can take voicemails, and there's multiple people on the hotline, so timing is more flexible. Also, ease of referrals. So we got our folks right there online, plugged into our databases, able to customize referrals to other systems that every individual calls in. So food banks that are near them, that kind of thing. And one of the most important to us is it provides this administrative hub to all client services. So while we were just talking about mobile outreach being more efficient per dollar per app, without our hotline, we'd have a hard time supporting that mobile outreach because they're actually plugging into the database, which is built around the hotline. Weaknesses, the hotline is, there's potentially less rapport when it's face-to-face, or less rapport than face-to-face. So, you know, a lot of folks, the phone, you just lose some of that tone. You don't get the engagement that you do face-to-face. And given our current business practices, it is more expensive. It's a more expensive way to get to the app. There's other good things about it, though. So that's hotline and referral. Mobile outreach, the reporting can be better when you're sitting across from someone, when you're walking around the clinic and really engaging people. It also removes transportation barriers. We're going to where people are. So that's super important. You know, for a lot of folks struggling with food security, also struggling with things like transportation. Also cost efficient. So given our current business practices, we're getting more apps per dollar through this method. Weaknesses, limited geographic reach. So for us, we're primarily Denver Metro with this approach, which is great if you live in Denver Metro, but if you don't, well, we're not reaching you. And limited time available. So we're available when we're there. So ultimately, this is great if you're where we're at, when we're at. But if you're not, then we gotta go to this hotline referral. Partner organizations. So one of the biggest strengths there is the potential to scale. This is the way we solve it. You know, we don't solve this problem alone. We solve it together so we can really scale this kind of work by working with other partners. It's also a diversity and reach. So we'll get different ways into different communities and different folks. And local expertise. You know, if you've worked in Colorado, you probably know there's a cultural divide when you cross the continental divide. And often, rightfully so, Denver feels, it feels to a lot of folks like Denver is too focused on itself. Well, by working with these partner agencies that know their communities, we can overcome that. Got that local expertise, local knowledge, local trust, local relationships. Weaknesses, variance in practice. So the way you get into the system will look very different depending on each partner. And there's also a high upfront or startup cost with sort of uncertain results. And we're already seeing that in our work. Some of our subrecipients are knocking out of the park and others aren't, but we're investing a lot into both of those that are doing well and those that aren't. And so there's kind of a risk there, but there's a big potential payoff with this scale. Now I'm going to come back to the partnerships and collaboration because in order to make this work, we need to all work together. So that's true in our daily work. You know, when we talked about the application and the eligibility piece, we're not working with our counties, with the state, then none of this really matters. Also with county departments, you know, we're a local control state, so those county relationships matter quite a bit. Local governments, cities, school districts, medical settings, we have a lot of referrals through the medical system at the moment. Other community organizations, nonprofits, all of you, ultimately to do our daily work, to do everything I was just talking about, we need partnerships. Two there, acting as an incubator. So for some organizations right now that are very sophisticated in the work they do, but this space is new to them, we're helping them kind of scale up, but we don't need to babysit them ultimately. Once they're up and running, they can go do this on their own. So that's part of our model. And then the last bit is leveraging and building upon each other. So all of you all. You know, I think as a system, we believe that we need to leverage each other's strengths and be sharing data, ideas, resources in order to really solve this hunger problem. So daily work, incubation, and ultimately working together even when we're in different regions or whatever that may be. And that is our presentation. Yes?
What are you learning from your partner organizations as far as what's working, not working, and are there certain settings that it works better? How are they funding it?
Yeah, so I think it's a little early to draw any like global conclusions because we have both an organizational capacity and a population thing going on. And so I'm hoping that, you know, over the course of the next 6 months that becomes more clear, but in some cases the approach may not be working, not because it's not a good approach, but because it's not being applied well yet. And so we're still kind of ironing out those issues.
And one thing I've always thought with the medical system, thanks for that, Andrew, is it might be really interesting to look at the different models based on what percentage Medicaid enrollment they have. So a Denver Health program would look very different than a Arapahoe Kaiser program. So trying to make sure that, because I think the trick is, I think you have 3 really great programs. It's how do you match it to what's the right intervention for the right population? And I think that might change, and that would really be an interesting to understand.
That's great.
Which gives you the best outcomes.
Thank you. Other questions? Or? Yeah.
So one of the things that I find interesting is that we do a little bit of work in Philadelphia, which is where we are, with some organizations doing application assistance where we're helping them kind of build their program. And one of the things they struggle with the most is once they go through their normal pool of individuals that they serve, they did a lot of in-reach. They start to see their numbers go down a little bit because now they have to expand their reach. So I was just curious if you're seeing that in the partnerships that you have and what sort of advice that you're giving them to sort of get to that next level of connection.
Yeah, so I think that's probably pretty typical for this kind of thing. We're actually on the upswing at the moment. So I think we're going to see it peak and then drop off. We haven't hit that peak yet. But you're right, once folks have kind of saturated their existing clientele, there's going to be a drop off in the absence of other coverage. But we're not there yet as a model, at least we aren't. Other questions?
What's your target goal for applications this year?
7,125.
And what's the, what is your, to Anya's, you know, I think we all know that there's a drop-off rate with the county eligibility. You're not going to get 100% submitted approved. What are you seeing as your approval rate right now with?
That's an excellent question that I don't actually have off the top of my head, but we can come.
So like 60, I hear like 65, 70% is what is national. Is that about right?
I mean, yes, it's in that range, I would say.
Okay, yeah, that's what I was wondering. Yeah, I just didn't know if your different models had different approval rates. Like if your in-person gets higher than your phone, or I'm just always curious about which one has just a different, especially if you have that face-to-face rapport versus the phone rapport and what you're seeing overall, and then with your different
that's great
partners.
So you're actually predicting what we're looking at in the next couple of months.
Oh, great.
Yeah. We haven't done that yet, but part of this, you know, we're starting with the application, but part of it is how many folks are ultimately getting benefits. And is there an outreach method that gets more people there, even if it's maybe not the best on the application side. So.
Right. And just one note on that is that between mobile outreach and the hotline or referral, our follow-up process is actually the same. That's all. Like that's another one of those. That's like part of the service that the hotline provides is that mobile outreach staffer, even if they're showing up to the same clinic once a week, they're not necessarily able to check in with the person they worked with last week. So all of those applications that aren't coming from partners are sort of going into our communal Hunger-Free Colorado queue that we can all follow up on and check in with people, check the status, say, hey, have you heard from your county? No? Okay, here's their phone number. Do you have any questions? Do you need additional resources? So there is going to be some overlap that we won't be able to fully parse out, if that makes sense.
It does. Do you use text around sort of reminding people when the 30 days might be coming up and like at recertification?
We don't at the moment.
Yeah, we're working on that. Actually, we're also trying to tease out what Anya was talking about. So, it's technically possible. It's just our system isn't structured to do it easily. But yeah, we're kind of unwinding all these questions. We're just on the beginning phase of that.
Other thoughts from either of you, having worked in this area, what policies do you think or state practices would really help you with enrollment?
You want to take that one?
Sure. I mean, especially now that we're statewide, we always have been, but I think we're starting to see more applications from outside the Denver metro area. We realize that there just really is a lot of variance between counties even. So I think, I know, so my background is that I was an application assistant, doing mobile outreach and on the hotline before going into policy. And, you know, I realize now as we hear stories from clients from all over that I thought this was the policy, this is how all counties work. The fact is it's not consistent across counties. So I think there's still some work to be done just parsing out exactly how all the offices work, knowing where you can say, oh yeah, if you show up this day, you're going to be able to complete your interview, even if you might not have a phone that they can reach you at. I think there's some work to be done just to have the basic, like, a foundation to actually guide people as best we can through a hard process. And then from there, I think just, I don't have any specific policy points, but just like simplify.
It'd be great to see counties not over-verify just because of like fear of not verifying enough or more training. Right. And I also think on-demand interviews is where we need to be heading. So that you can call right when you're with the assister and transfer and not have that de-link.
Mm-hmm. And I think that there's just this added complication of, you know, we have our state regulations and then we have county and office practices, and there isn't always a perfect lineup, and both shift. So that coordination piece is also complicated, and there are going to be 64 variations of it. I don't know if you have any.
Sure. You know, and when you make a policy change or recommend to make a policy change, you have all those counties get an agreement to be on board with the same practices. We've talked at length with many of the counties about the on-demand interview, and some counties can't support it. They're an office of 2 people. They can't just pick up the phone. Some of the larger counties, they already do it in essence. You can call in, you can complete it at any time. You know, we've been trying to hook up some of our outreach partners with the county to one-off make arrangements so that, yeah, I have Susie in my office and I have a connection point at County A where I can call that specific worker and connect. There's some work in El Paso with Carriage doing that. And I know we've talked a little bit about Hunger Free, trying to get some arrangements with Denver to do something like that. But that's what makes some of those waivers even tricky, because not everybody is able to do it.
In addition to the policy, sometimes it's myth-busting. So, you know, we've come across a few counties that just had a different understanding of what the policy actually was, and, you know, and some counties are really sophisticated, and others, like, this is one person doing every human service program, and they just started doing it 6 months ago, and like, you know. There's that, and then also within policy boundaries, there's a lot we can do, I think, just to show counties what helps them, why why this is of interest to them, how to make their life easier, whether or not it's crossing the policy boundary.
Karen, just one question for you, because I've heard it both ways, and I think I know the answer because I've read everything on it, but a client can request and the county has to mail a card if it is requested. Okay, so the county director did not know this, so I'm not sure how we get that out.
We continue to struggle
Okay.
with counties understanding and accepting that.
Okay. Yeah, it was Big Ten director, and then that was set out into a form with community partners and application assistants, like, no, if you're helping somebody in the community and they do a phone interview, they can get it in the mail. Yeah. Okay. So maybe all of us can help with that, you know, when we're in these meetings too. But thank you for.
Great example of busting. Yeah. All right. Any other questions or comments? All righty. Thanks, guys.
Thank you.
Thanks, Brett.
Well done.
So we are lucky to have in person our friends and colleagues from Benefits Data Trust, and they're going to run through some of, I haven't seen their presentations, so I can't tell you what they're going to run with, but with Hunger Free and Benefits Data Trust, they're our two largest outreach partners in the state of Colorado, and so between those two, they do the bulk of application assistance and submission. So it's really great to hear about the different models. So thank you for being here in person from Philadelphia, and Heather, thank you for all your work in Colorado.
So we thought, we thought it might be a little bit easier for us to do a little bit more background on BDT, since some of you are really familiar with us and others of you are much less so. So I'm going to try to do a little bit of background quickly, but hopefully this is, you know, you'll have access to this later and can kind of dig into the details, and you'll have our contact information at the end if there's anything more you'd like to follow up on. But I am going to go kind of quick on the BDT overview so that we have enough time for the more interesting things. So just a little bit about BDT. Most organizations that they cover a lot of different types of issues, or you know, they cover a lot of different ways to support low-income individuals. And at Benefits Data Trust, we think about public benefits, everything about benefit programs, all different kinds. And so the solutions that we deploy are very focused in that realm. We really want to figure out what are all the innovative ways that we can increase access to public benefits, and know that, you know, I totally agree with the sentiments that we all have to do this together, that there's a lot of work to be done. And so you'll see that we have a diverse set of things that we do, but all around benefits. So it makes us a little bit unique. So there are several strategies that we undertake. One is focused around data and technology. So one approach that we do is when we look for people who might be eligible and unenrolled in benefits, it's really a data-driven approach. So we work really closely with state and local agencies, and in some cases community partners, to develop lists of individuals who might be getting one benefit or service, but not another. So for example, if somebody is getting Medicaid or another benefit but not SNAP, that's a really good targeted list. And so we then can outreach to a pool of individuals that we know are eligible and not enrolled already. And then the second piece is that a lot of our work is tech-enabled. So while we do some direct service back in Philadelphia, a lot of the role of the individuals who do that work is supported by having a technology system that helps them remember all of the different rules for the applications, in addition to lots of training that we provide them. The tools support them through that work. And we try to deploy the technology solutions in a way that we can start to explore how not just our BDT staff can take advantage of that technology, but how can the community also take advantage of that technology. So we do have a contact center in Philadelphia that manages our phone work, and we also believe that in order to do the work, you have to work at a systems change level as well. So BDT has provided technical assistance to states to to submit various waivers to simplify application processes. So we have a hand sort of in that as well. And finally, as I said before, everything that we do is absolutely dependent on partnership, cannot be done alone. So just to kind of give you a sense of our national stats, you know, in the 13 and a half years we've been in operation, we've submitted over 800,000 applications on behalf of individuals, bringing in $7 billion in benefits from those enrolled. And in our 6 states, you can kind of get a sense, click again, Heather, of where we are doing work. So you can see across the top, these are the 6 states that we actually provide that contact center application assistance. And then we also do, you can see some of the policy work that we supported, as well as, and I know some of you may not know what some of these things mean, and I'm happy to answer, but they're just specific examples of policy work that we've done. And then as you get to the bottom, you get towards the technology solutions in terms of text nudging, using behavioral economics. Community Prism is a version of our tool that the contact center uses that we make available to community partners in Philadelphia, where we help with 19 benefits. And benefits launch, we're going to talk about a little bit more, but it's a high-level screening tool that we'll be rolling out in Colorado. So now, Heather, take over.
So let's talk a little bit about our impact in Colorado, how long we've been here, and what our outcomes have been to date. So we first started in 2014 working with CDHS and with Hunger Free to select senior Medicaid folks, people who are receiving Medicaid but not yet SNAP, to do outreach and application assistance, doing the application assistance over the phone through the Colorado Benefits Center, which launched in 2015 to the main 10 counties, so Denver Metro and those other the urban counties. In 2016, we moved from just receiving the senior Medicaid data to also receiving LEAP enrollees, so seniors who are receiving LEAP but not yet receiving SNAP, since eligibility guidelines are pretty similar. And we saw a really great response from that population, and also helped increase our outreach efforts. We then rolled out statewide in 2017, so going to all 64 counties, which was a great feat for us, but still kind of seeing those hiccups in county communication for folks who are in the more rural areas about really understanding who we are and what we do. So we're still seeing those barriers from that, but we are statewide. In 2017, we did a pilot with HICPA, so we reached out to folks who were 18 to 59 who were receiving Medicaid and Medicare but not yet enrolled in SNAP. And that was a great pilot for us to kind of see what our all ages outreach would look like, and also gave us an opportunity to partner with some of the trusted organizations in some rural counties that we didn't before have great responses in our traditional outreach for, but we did see an increase when we did partner with those trusted sources for us. We completed our statewide expansion just last winter. And then this year, with this state outreach plan, we've expanded to all ages. So before we were just helping seniors over the phone, but now we have increased those lists to include all ages who are receiving Medicaid, and also all ages who are receiving LEAP but not yet enrolled in SNAP. So that's something new for us, and we're really excited to get some lessons learned from this. And then kind of what Aaron spoke about last meeting, we partnered with WIC to do an outreach texting pilot to get people engaged in responding to their local WIC agencies to get an appointment. Those who are already receiving SNAP but not yet enrolled in WIC, to connect those services. And in 2018, with that, we've also started message testing and texting outreach. So our traditional mail outreach is what our bread and butter has been, but we also want to complement that with technology. And we have access to people's phone numbers, and we want to say, well, if you have a mobile number, we want to kind of increase that response time and send you an engagement now. And so we have the opportunity to do that. And in 2019, later in the next couple of months, we're going to be doing benefits launch, and we'll kind of go over that a little bit. This is just our outreach process overview for those of you who aren't familiar with the work we do and how it reaches our contact center and do our application assistance. And so I won't go over each one of these, but you can dive in a little bit when you receive the slides. But we do take the list, create letters, send them out. People call into our contact center. We screen them over the phone, see if they're likely eligible, and then prepare their documents and submit through Peak Pro for their application. And we do some follow-up reminders and next steps, and hopefully we can increase those next steps and reminders into our texting. That's something that we're also working on. And of course, always evaluating the data. So just overall, to date, this is our impact in Colorado. We've touched about 165,000 families with our mail outreach. From that, we've spoken to almost 30,000 folks over the phone to screen them for benefits, submitting almost 12,000 applications in the last 3 years that we've been active in Colorado. And our enrollments, we see about a 70% enrollment rate, 69, and it fluctuates just depending on, when we first started and to where we are now. We do see it increasing every year, year after year. And so we have a projection of about 8,000 enrollments from those applications. So our outreach strategies, like I said, we do traditional mail. That's just for the traditional mail that we do, and we partner with CDHS to do a branded letter. It's coming from, looks like it's coming from the agency. In the past, we've had it signed by Reggie, who was the executive director, and so that created a little bit more legitimacy to the program, and it was really successful with our seniors. We also do robo-dialing, so for the people who we are mailing, we also maybe do a follow-up call if we haven't heard from them, let them know we sent you a letter and we'd like to speak to you. We think you might be likely eligible for SNAP and we want to help you apply if that's what you would like to do. And it's an alternative to the text messaging and just helps boost those response rates. And then text messaging, which is new for us this year in the state outreach plan, we tested it with our HICTUP work and we saw a quick response. Typically we see it taking about 3 or 4 weeks for people to respond to our letters, where with text messaging, we saw a response in about 4 days. So that really helped increase that response rate. We got more interaction, and it works best with folks who are younger, which is kind of a little obvious for us. Some of the results from our outreach letters, we just depending on the population and the kind of list that we're using for these targeted outreaches, depends on what we see for our responses. So this is kind of from our HICPUF work. We sent out an urban letter with the CDHS. It was branded through CDHS. We sent out a rural letter, which was branded by our organization as like a nonprofit letter. And then we also partnered with the Independence Center as our trusted source. And that was somebody who's familiar, people could be familiar with in the community, and we saw a better response from those. And this was especially great for us because we sent it to regions where we usually saw about a 4% or 5% response rate, and people, it tripled or quadrupled in some cases. So that was great for us to see, and kind of reinforces how we're collaborating together and, using each other's strengths and recognition of the community to achieve these results.
So did the letter originate from the Independent Center?
Yeah, we worked with them to craft a letter, and we used their branding. Their executive director signed it, and it was our same message almost, but having them call our center, right? So nobody went into them. They still came to us, but it was branded by them. These are examples of what we did with them, how those letters look like they came from them to direct traffic to us. Just a quick overview of what we did with Erin at CDPHE for our WIC texting pilot. These were families who had children under the age of 5 in the household who were enrolled in SNAP but did not show to be enrolled in WIC yet. We did dynamic text outreach to a little over 10,000 households to help them schedule WIC appointments and gain interest in asking for a response from their local WIC agency to schedule that appointment. And we did that through 6 WIC agencies that worked with Erin to do the training and understand what the project was and what our goal and aim was. And we did find that adding a monetary value to outreach really increased our responses. So this is kind of like an example of the text message that we would send out. And this probably got the best response for us from any of the messages that we sent out. And so that brings us to benefits launch. So this is our newest project that we just launched in Pennsylvania, and it's coming to Colorado. An option for us to connect and assist people to the best mode of assistance that they want to pursue. So whether it's through directing them to Peak Road so they can assist themselves, if they maybe need some more assistance and they can't leave their home or have mobility issues and they want to use a contact center, they can call in for phone assistance. And then this is also an opportunity for us to drive traffic for in-person assistance, whether it's to somebody that is doing SNAP assistance at a food bank or a mobile unit, something like that. We could drive the traffic for in-person assistance and give them that referral. And we're hoping to launch this in late April, and we're working with CDHS right now to do our content and do policy review before we do go live with the tool.
One thing I just want to add about Benefits Launch too is that, there's a lot of really great efforts going on, obviously, across the state. And so one of the things that we wanted to do is say, okay, well, what is BDT's value proposition in Colorado? What can we bring to the table that's different? And so one of the things we wanted to do was try to build a solution that would help to connect all of the great efforts that are going on across the state. And so we can talk a little bit more about what that means, but just wanted to make sure that that was clear.
So this is an example of our landing page. When somebody visits the site, just gives them some information about what they're gonna expect while they're using the tool, and give them a little information about what is SNAP. There's some FAQs about anything about who we are, or what SNAP is, or how they can find assistance on their own without using the tool. This is just a quick prototype of what that's going to look like.
So one of the things on that too is that we're in the process of really getting ready to do some user testing. So again, if we want folks to find value in this tool, both partner organizations and individuals alike, we really need feedback and we need support and participation from others. And so if you would be interested in doing some of that testing with us, or bringing some individuals that you serve to the table, that would be something else that we'd be interested in talking with you about.
And if you want to write a request, we can also send it out, because some of our partners who aren't at the table, like food banks, have people with lived experience in SNAP, ED, and Promotora, so they might be other people that aren't in the room, and we'd be happy to, we want as much user input, obviously, and user input as we can help.
We'll definitely take you up on that.
Great.
So once they're done using the tool and they look like they're likely eligible for benefits, they're able to either send themselves to Peak to apply, call our benefits center for application assistance over the phone, or we're going to drive traffic to an in-person assistance site. Right now we are just listing county assistance offices, so that's the one place they can go. But we also want an opportunity to drive these qualified leads using CDHS data and any of our other lists of data that shows somebody is highly likely eligible. Drive that traffic to in-person assistance sites by listing some of those food banks or, wherever it is that currently people are receiving application assistance. And then connecting people to Benefits Launch, this is just another way for them to connect to the assistance that they're going to need. Is there anything else to add to that? That's it for us. If you have any questions, yes. Go around the table.
Yeah, I think, so I want to go over, I want to get some, we want to have a discussion, and I have some provocative questions, but what's interesting to me is that you're saying that your new contract allows you to reach all ages, which I think is great, right? So, but there's 646,539 people currently on Medicaid, but not SNAP at or below 130% of FPL, which is really different than the EB&E from FNS, right? That puts it about 300. You guys can't possibly be doing outreach to 646,000 people, right? So how are you, because there's not enough funding, and that'd be great if we had enough to, so what are your strategies, and how much can you push out in that all ages? What's your goal kind of monthly, and then how do you figure out which counties to target? So I'd just really like to hear about that strategy, because I think that is, the known eligibles are where we need to go. Mm-hmm. So whether you're hunger-free, BDT, care and share, a hospital, what is your part in that, and what do you think you can accomplish?
Sure. So I think there is a really big list of people. We won't know the exact number until after we get the data and do the data match, which we've just recently gotten the data, so we need to do a little bit of that work and compare it to the list we already have for outreach. So keep you posted on what that looks like. But basically, BDT's contact center, I mean, we operate a contact center of 70 people that do their work in different states. And so we have to be smart about how much outreach we can send so that we can answer the phone. Because the last thing that we want to do is reach out to people and then not answer the phone. And so we take that very seriously. And so we have a lot of focus on what is, if we have a new list, what is the trajectory in terms of the response? How does that look? Does it, start with, a slow uptick and then there's a swell for 2 or 3 weeks and then there's a tail, and what happens when you're, what's the sweet number to mail each week? And I have to say that it really does depend on the list. So for example, when we reach out to people that are getting leave benefits, for example, like you might end up with a response rate around 35%, especially if it's a senior list, right? But we've never outreached to those individuals that are all ages. So when we do that for the first time, we're going to be conservative in the amount of mail that we send first, watch what the responses look like when they come back, and then once we have a level of confidence of the response rate and the timing of those responses, then we can start to ramp up and be a little bit more thoughtful about what happens with that. There's not necessarily a set number because it depends on the mix of lists that we're sending each week. That's part of the process and why it's nice to be able to have a larger contact center. It gets you flexibility and enables scale. And I think in terms of the strategies, I mean, this is work that, if we could, flip the switch and, all of us serve every person in the state immediately, we would do it. But obviously we have to be incremental about it because of the funding constraints. And so BDT is committed to doing this work for as long as we're needed. And so we're not going anywhere. We're going to keep pursuing these individuals. So.
I just really want to answer that question, like how do we get to, and I think that'll be more of a dialogue, but kind of wondering, I can't wait to see like what you can do because it is about financial constraints. But I really am curious to see what your response rate will be, because certainly your model will chip away at a certain percentage of people who are tech savvy, whereas Hunger Freeze is kind of a different target population, and then the on the ground kind of state application assistant model. But it seems daunting when you say we can now reach out to all ages, and I know that it's this big of a number. It's hard when you know what they are.
It was always that big.
Yeah, I know, right?
All we do is know who a few more of them are and where they live. So,
and we're working with CD just to be really strategic about who we're trying to get on the list. Like, we're not going to get everybody. Right now, we got some people who are on shift, so we're going to maybe outreach to families, and a certain amount of folks who are on Medicaid and not on different types of Medicaid. So we're just trying to be a little strategic to make sure that the people that we do get, that we're going to try to outreach to those folks. So it's not going to be the 760, but I think we got about 20,000 folks who are on leave, and that's a great place for us to start.
And I agree. I think it's an all hands on deck, every type of strategy, because, for example, I think, in person is, you already talked about some of the pros and cons of each of the strategies. I imagine the reason that you do a blend of them is because that's where you get the most people, right? That's where you get that reach. And so we totally agree. That's been our experience as well. And I think the tricky part is that individuals who are disconnected and not walking indoors aren't going to just all of a sudden start doing that. And so the community reach is going to get you a certain number of people. And then the data-driven strategies help you find those that are maybe closed up a little bit more and really not engaging, and you can serve them right in their home without having to leave, which is another core component. And in the same way, those strategies are never going to reach other types of people that really do need that in-person and trusted source and all that sort of thing. So it really has to be a combination of all of the strategies.
Can I ask one more question before you move on? So one of the things that I think we all, and actually all the work groups are really struggling with, and when I talk to counties, so it's this whole texting piece, right? So we have some counties doing certain texting as one-offs on these certain platforms, and then we have WIC testing their texting, and I'm not sure where HICPUF is on their testing, but we don't have a centralized platform, and we don't have people using behavioral economics and really science-based messaging that they can test and refine. Is there any way that we could get to a point where the state agencies and their funded partners could use the best-in-class behavioral economics and texting platforms, so we're not reinventing the wheel at every county, like someone said 64 different ways. Some counties not having any, so then their churn rate goes up because no one can remind them. So I'm just wondering, like, could we possibly, between the outreach partners and the state agencies, and have you seen that happen somewhere else?
Well, it's a good question, and it's an important question. I would say New York City, and they're just a city, they're not a state, although it's kind of the size of a state.
Oh, it's more than us. We only have,
But they're the closest I've ever seen anyone come to doing something like that, and they have multiple city agencies that they're trying to coordinate and get everyone using the same platform, and they want to have like a single eligibility tool that grabs the data from all the different departments and matches them and figures out who's enrolled in what, and then directs that information to this outreach tool that will customize messages, just as you said, and send it out. And I will tell you, they're a couple of years in with many years to go. So it's not impossible, but definitely takes a lot of commitment from a variety of stakeholders, everybody working together to get there. And definitely, they have their mandates from their city council as well as the state, and then each of the agency leadership. So, I think it's something worth pursuing, and being excited about the incremental wins is really important. We can sometimes look at the idea of building this unified system that's all connected and and see that that's sort of the end state, and be overwhelmed by that end state and how much effort it takes to get there. But if we can bite it off a piece at a time, it starts to become manageable.
I'd love to see it start with R3s for SNAP. I mean, to me, that's the biggest bang for sort of the system redesign, and I'll stop now.
Are you going to add the monetary value for SNAP like you did with WIC?
We actually have always done it with SNAP, yeah. So that 126 is on our letters.
And are you also going to do WIC?
We're not currently funded to continue WIC outreach in Colorado, but I'm sure Erin has ideas about where the agency is going with that going forward.
Oh, that you could team and also do the statewide.
We are a committed brainstorming partner.
Okay.
We will sit at the table and talk with Erin and her team about anything moving forward. But we are currently not engaged in texting for WIC right now. Yeah.
Just a quick question. There's a website that exists, I saw gatmat.org/calculator. It's just like a Colorado-specific food stamp calculator. And it has a few links for people to go to Peak and to contact their local county offices. And really, it's just meant to give people a pretty precise estimate about how much monthly benefits they're entitled to, assuming that they put the right information down. I'm just wondering, is that kind of similar to what you're envisioning with your campaign for the benefit launch?
So I think what we really want to do is make something that's really easy for people to click through and connect to existing resources. So if that's what that does, then I would say yes.
But it doesn't give them an eligibility like that you're likely eligible for $94 a month. It doesn't do something like that, but it does say based on what you put in here, you might want to go forward with an application, and these are your options, in person, on the phone, or to a site. But it doesn't, we've used that calculator often, just like as a tool for us to use, and it's really helpful, but it's not as detailed as what's incorporated into that tool.
I think one of the things that we found in working with eligible populations is that the more questions you ask them, the more they're going to put up their own barriers to moving forward. So I think the spirit of the benefits launch is to really make it simple, easy, quick. I think it takes less than a minute to go through, and then really to make the connection to the next step that can allow you to go deeper. And especially if you are somebody who is going to get help either over the phone or in person, all of those questions get answered for you, because when you're starting to go through that question on your own, you could come up with a million reasons not to move forward. That's something that we typically see. I think that happens with Peak as well. And so our goal was to sort of get people interested, excited, get the word out, have a quick screening to see whether or not they're eligible, and then get them to the right support to get them over the next hurdle of actually completing the process.
And I think like our experience, we also didn't want to have them to duplicate those efforts, because often if they called us after that, they said, well, I've already answered all of these questions, why am I repeating this process? And so it was kind of just a way to minimize all of that.
So one of the things that happens is that when individuals complete the screening, if they call the contact center, they don't have to answer those questions again.
So I guess the reason I'm asking is because, as I understand, Peak already has a very simple, am I possibly eligible or not screening. And we thought that was marginally helpful, but people really want to know, am I going to get $15 or am I going to get $200 a month? So that's why we spent time putting together this more specific SNAP calculator so people could get a more precise estimate.
Yeah, and I think our goal wasn't to recreate a screening tool. It was more to create a tool for people to drive themselves to application assistance that was best for them. So whether those options are, to go to a hunger-free site and get that assistance in person, because that's what they're going to need. Because the tool that is Peak Pro right now, there's many benefits that you can see if you're likely eligible for, and that's awesome, because then they can go from there. But what it doesn't have is, well, I want help now from the folks down the street. Can they help me? And that's what this is intended to do.
The other thing too is that we are looking to deploy something that we call guardrails, which is follow-up processes. So if somebody, let's say somebody does the quick screening and they say, you know what, I'm an independent person, I'm going to do this on my own. They go to Peak, right, and then they get stuck. And they're like, you know what, I'm not going to do anything else about it. Well, what we're going to do is have their information so that we can actually follow up with them and say, hey, did you make it to Peak? How did it go? Do you need any help? And then we can always connect them to a different channel. Like, okay, if you've changed your mind, maybe you can get a little bit of phone assistance, or maybe you can, in-person assistance is best for you. So we want to make sure that we're not just providing somebody with information, but that we're actually doing that proactive follow-up to make sure they go through the steps.
So people have to give their contact information to use.
It's a choice. They get to make a choice.
Is it possible to see a prototype of this?
Yes, we would love for people to look at the prototype and help us refine. So are you signing yourself up?
Oh, yeah.
Yeah, I'd love to see it. Yeah, well, we can
You just volunteered.
Yeah, we can send it out. It's a staging prototype right now. So, some of the content is always changing. Like the photo that I showed you is not updated in the staging site yet, because that was just based on some feedback we did on Friday. So it is constantly changing, but some of the logic is in there for estimated eligibility, and we have some prototypes of where to go for in-person assistance right now, just as what it would look like for you if this was your path.
Yeah, if you don't mind sending it out, that'd be great.
Not at all.
Do you have a list of those organizations who do the live assistance?
So that's who we're trying to connect with now, because we don't want to list somebody who isn't prepared to get that traffic and who we haven't spoken to. And so we want to onboard those folks. Right now, it's just going to be the county assistance offices, because that's who we are partnering with now. But we would like those organizations' permission to drive that traffic.
Okay, so if you reach out to me, there are some community organizations that I know that are doing that work.
Great.
Because even a call back after you've given up on Peak, and nobody climbing that mountain again.
Yeah.
No, we got to talk about Peak at some point. I just in looking at the timing, we should probably move on to the next presentation and then have a discussion.
And we're also coming to you guys tomorrow, so we can chat a bunch.
Yeah, sounds good.
Yeah.
Thank you so much.
Yeah, thank you.
Really rich. So we're lucky enough to have Michelle Trujillo. I will let her introduce herself, but she's one of my favorite folks in the world, and she's an amazing director of economic opportunity and all of the public benefits in Mesa County. She's one of the most collaborative directors I had the pleasure of working with when I was a county director and into the Blueprint. And Michelle has been working with her community partners in Mesa County. They hosted, Alexis and I did a kickoff for a blueprint in Mesa last May, and they have really taken that and run with it. And Michelle is going to update us on their efforts and what that looked like, and hopefully tell us some of the things that would be helpful to support their efforts and also learn about what's happening there. So Michelle, take it away.
All right. Well, thank you so much, Jennifer, for that introduction. That was very kind of you, and you're one of my favorite people, too, just so you know. Like Jennifer said, I'm with Mesa County Department of Human Services, and today I'd just like to share a little bit with you about what we've been doing here in Mesa County with regard to SNAP and WIC efforts in our community to reach eligible but not enrolled populations and to retain those who are currently eligible. Jody Valente, who's with Western Colorado Community Foundation, is one of our big partners in this effort, and she's not able to be here today, but I heard Sarah Robinson is on the phone, and she is another one of our big partners. So Sarah, if you're still there, I would love if you would chime in here and there if it's right for you. So if you want to go to our next slide, please, Kevin. So this slide just kind of talks a little bit about our efforts to date. So nearly a year ago, as Jennifer said, Western Colorado Community Foundation convened a group of community leaders who had a shared interest in addressing hunger in our community. It was called the Leadership Forum on Hunger. Colorado Health Foundation co-facilitated the event. We discussed the blueprint, and we started a conversation about pulling together a local action plan on how to end hunger here in Mesa County. And of course, Jennifer was there with us. From that initial meeting, we then formed a work group that consisted of various community organizations, including the school district, other government agencies, the local hospitals and clinics, and our regional community foundation, among others. And to date, our group has now met 4 times, and we've really been discussing increasing education and coordination of SNAP and WIC enrollment through community-based planning. One of the first needs that we identified since we've been meeting was the need for trained volunteers to act as SNAP or WIC ambassadors, is what we're calling them, to have them strategically placed throughout the community to assist with SNAP and WIC enrollment using the PEAK online application. And if you want to go to the next one. So this slide shares the leads who've been working on this project and what their roles are. So Mesa County DHS, that's myself. We're administering the SNAP program. I've been doing training on SNAP with those volunteers and ambassadors. Then Mesa County Public Health, so Sarah Robinson. They administer the WIC program, conduct the food insecurity research. They're a grantee for SNAP outreach. And they're also a connector for PEAK Pro for us because we've been looking at the possibility of bringing PEAK Pro in. Then Jody Valente is with Western Colorado Community Foundation. She's really been the coordinator for us, convening the work groups, conducting food insecurity research, looking at funding. They're also a grantee through Colorado Health Foundation's planning grant on food insecurity. And then we have a number of other community organizations who've stepped up to volunteer to be ambassadors to assist folks with applications for SNAP and WIC through PEAK and increasing those referrals to those 2 programs for us. And go ahead. So the goals of our working group, the first one is to work strategically as a team to increase enrollment in SNAP and WIC. For example, when we're looking at resources, we're looking at ensuring that we're using our available resources the most efficiently as possible. We're also looking at, between our organization, leveraging our resources to make sure that we can maximize our effectiveness as a group. The second one is providing research and application assistance to complete applications correctly the first time they're submitted. So at the county office, we get applications from folks that are incomplete, not filled out correctly. And our hope is through these ambassadors who are educated and knowledgeable about what's needed for a good quality application that could be processed quickly, those applications will get to us correct the first time, so it doesn't take as long to process. Also, the third one would be looking at reducing barriers and then provide support to consumers with navigating the enrollment process. And the last one, improving SNAP and WIC outreach and delivery to eligible residents. And go ahead to the next one. So this is just a bit of a timeline since our working group has started meeting of some of the things that have taken place. So the first one in July of 2018, CDHS announced the launch of the My Colorado Benefits application for smartphones to increase consumer self-sufficiency and improve the customer experience. And we've really been working on getting the word out about this app to increase the awareness of this app to empower customers to take a more active and direct role in managing their case. We think this is something that's really helpful to the consumers. And we've done that through handing out postcards, through social media, verbally telling people about it, just trying to get the word out about the availability of that application. In the summer and fall of 2018, Sarah, are you still on the line?
Yes, I am.
You want to take these next two bullet points?
Sure. So for summer and fall of 2018, WIC added some co-location. And so part of that was expanding to one of our largest pediatric practices, just to be more readily available. So when kiddos come in for their well child checks, or if it's a different appointment and it's convenient, that staff member can pop right into the exam room. They can go ahead and get their benefits updated or enroll families that are new to WIC. We also added a location at Hilltop Family Resource Center where they're doing enrollment in a Before Babies program and also tobacco cessation for our pregnant moms. And we recognize that it's also a good place to go ahead and get a foot in the door to do the same. Just make it as convenient as possible for families to engage in WIC. And then the last section is about the texting campaign, which is, we were originally one of the pilots, and my understanding is it's now standard practice. Couple bumps in the road, but real exciting. Again, trying to make it as accessible as possible to our community members.
Okay. And you can go to the next slide, please. Okay. In September of 2018, DHS, Public Health, and Western Colorado Community Foundation, together we presented at a local Human Resources Association conference on food security and the local efforts to end hunger. And it was a really great audience to speak to because these are the HR folks who tend to have those conversations with the employees in these organizations who may be struggling. They have that awareness of what's going on a more personal level many times in their employees' lives. And I think it was really eye-opening for a lot of them to know that these resources were available and that they can do referrals for their employees to these programs to help those who are struggling with food security. So that was a really great opportunity for us to reach a large number of people in the business community to address hunger. Then in September of 2018, the Essentials for Childhood grant was awarded to Mesa County Public Health and Hilltop with a goal to increase economic security by decreasing stigma surrounding food assistance and increasing enrollment in the program. And Sarah, did you want to speak any more to that?
Sure. We're one of 3 counties that was chosen to do this. The ultimate goal is reducing child abuse by creating that economic stability, which I think it's just one of those really great efforts where everybody's starting to look upstream and recognizing we can't really impact these huge issues unless we're addressing that economic stability picture. So that's just kind of exciting.
Yes. And then you can go to the next slide. Okay, in October, one of our local physicians, Dr. Andrea Netterveld, she submitted a grant application to Colorado Evaluation and Action Lab with the purpose of addressing Mesa County food security by improving SNAP and WIC outreach and delivery to eligible residents in our community. So we had the opportunity to review that grant application with her and provide some feedback as a work group. Then in November, The next thing that we did is we created a job description, basically, or a volunteer description for individuals who are interested in serving as a SNAP ambassador, to try to put some guardrails and some expectations of what is needed of somebody who is volunteering to serve in that role and helping us work with folks who are potentially eligible for SNAP in the community. Then in December, we were notified that Dr. Netterveld had received, her grant application was accepted and will be funded by Colorado Evaluation and Action Lab. The title of her grant was Addressing Food Security by Improving Referral Systems Between Medical and Social Service Providers in the Community. And basically, they're looking at the use of technology and other referral systems between the medical and human service providers to help connect those who are suffering from food security with SNAP, WIC, and other programs. So that's pretty exciting. That piece is just getting started. And our next slide. In January is when we started really reaching out to the volunteers, the people who were interested in serving as those SNAP ambassadors. And we started doing walkthroughs of the PEAK application, screen by screen, and showing them, how do you fill out the screens? What are some common things that people miss when they're filling it out, just to make sure it's filled out correctly? What are some of the things that they need to know to make sure that the correct data is in there? So we started doing that, and we started by meeting with the local Cooking Matters group in our community and some other volunteers through a local nonprofit, Hilltop, and did that demo with them. In January, as a group, we did another demo. We walked through the PEAK application in the same way we did with the Cooking Matters group in Hilltop, just to show them the best practices for submission of that application. And then we also developed a Google form that can be used by any of these SNAP ambassadors who are working with folks in the community, so that we can start tracking how many folks that they're working with. That information will be funneled back to me here at DHS, so that I can, on the back end, see how successful we are in getting these folks actually enrolled. So the ambassadors are doing that initial footwork with them, and then I can pull data together to calculate how many people actually made it through the process to become enrolled in SNAP. Next slide. So this is our last slide. So just to talk a little bit about support and resources. So where it says snapshot, it says the Food Assistance Department doesn't have the staff resources to increase SNAP outreach activities. Right now, really the county focus is on ensuring that we're operating as efficiently as possible, so that we can effectively handle any increased caseload or workload that results from this outreach effort. So we want to make sure that, while we've got this army of volunteers out there in the community who are working on assisting us with increase in enrollment, that volume of extra work coming into our office doesn't slow things down. We want to continue to make sure that we're serving everybody, regardless of how many folks are coming through our door, at a minimum of 95% timeliness, if not better. So we're focusing on making sure that we are as efficient as possible. Next section, resources needed. So the first bullet point is just talking about the group of volunteers that we have in our community who are going to be working with SNAP clients to assist them with completing the PEAK applications and getting connected with our programs. So that's really been our primary focus so far. These next two bullets are kind of wish list things that I would love if this might be something that this group can consider for something in the future. The first one is marketing materials or publications that simplify the SNAP application process. Just something that we can arm these ambassadors and volunteers with as they're doing the outreach in the community. I think that would be very, very helpful. And the next one, the last bullet there, is any type of marketing materials that incorporates language on the positive benefits of SNAP, including a focus on increased nutrition when families face times of need. So the last two bullets there are kind of asks or things that we would like to have, and hopefully we can identify resources to make that happen. And that is all I've got. I should have put a contact slide at the end, but didn't think of it. But Jennifer has my contact information. Any questions?
Michelle, I just want to say that work is amazing, and I'm really excited. I mean, Mesa is certainly taking the lead on like action. So a lot of communities have done some planning, but the work that you're doing activity-wise is just really inspiring. So I just wanted to kind of throw that out there. And then one of the things I don't know if you have any early outcomes from the September 2018 Essentials for Childhood grant. What have you learned around trying to decrease stigma so that SNAP enrollment will go up, or is it still kind of a work in progress?
Sarah, that would be you.
Oh, I am so sorry. I was just switching over to my cell phone because I'm about to travel. The question?
Have you had any, do you have any feedback or any initial learnings from Essentials for Childhood grant around decreasing stigma to encourage SNAP enrollment?
So what's interesting is we've done some preliminary work with existing parent advisory type of groups. And what's interesting is we have found that people are far more open about sharing their personal information and talking about things than we had expected, than I think we as service providers are used to. I think we're very careful about walking around the edge of things. And so that's just an initial feedback that there's more opportunity there. We actually have our first full meeting this Wednesday with a family advisory. So more to come. And yeah, I'd love to stay connected, and I'd love to see if you could share like high-level bullets of what your implementation plan looks like, because I think a lot of folks are trying to figure out. I mean, I think with everything we do in the blueprint, we're trying to make sure that we have community voice integrated into it, and particularly with Michelle's to ask around messaging and marketing, that actually is being taken up by Workgroup 1 moving forward with recommendations to provide those types of materials. And we know that we need iterative feedback from folks about, you know, what stigma and what barriers might be happening in the messaging and marketing, so we can make it as relevant as possible. So any information you could provide to us, even, you know, it can be confidential if you'd like, would be really helpful. I would say the first thing right out the door, though, to keep in mind, we were originally thinking like, oh, we're going to have focus groups just around this. Well, the type of people that come out to focus groups are really interested in that one existing issue. And so we're trying to generalize all of our focus groups and advisory groups. So rather than having it be attached to just one primary care office or one service provider and, you know, providing feedback just to that one entity, we end up getting people that are really interested in that topic or in that service. But the people we really, really want are people that might be impacted by food security, or they might not, or they might be on the fringe of it. They're not the ones that are necessarily going to come to a group that's just about that issue. So we're trying to generalize all of our advisory and community voice options so that we can ask them a variety of questions. And that way we'll get a better representation, I think, of true, authentic community voice. Thank you very much for that. Other questions in the room? Anybody super impressed like I am? Everyone's shaking their heads and yesing.
All right, thank you. And thank you, Sarah, too.
Yeah, thank you both. So given, so the last few meetings we've heard from a lot of different folks about the resources that they're bringing to bear. I'd love to hear kind of what's been resonating most with you and how you see yourself in the work of this particular goal. Again, you know, I've done some rough estimates. You know, in order to hit our 90% goal, using the most recent data, we need to do 230,000 new enrollments, people enrolled over the next 5 years. So, so given that that's our charge, I would love to hear kind of what you've been thinking about from the information we've been getting, and then the interim kind of thinking and what we've heard today, and just generally kind of throw it back about what resonates and how you see yourself in this work.
I think one of the other things, let me just pop in here, is that we continue to hear, and I heard in the conversation several times today, and part of what we heard from the steering committee when we were developing the blueprint is that people want to work together, we need better coordination, how do we bring all this together? And so I'm wondering if, given the conversations we had today, where I heard that come up 3 times again, sort of what's keeping us from doing that now? And how might we change that, given that I hear that desire and intention from folks? And so how do we switch that? How do we change where we are and get us to a place where our intention actually proves that into reality? We are working well together. We've figured out those things that have kept us from doing that, and we're in a different space, maybe 6 or 8, 9 months from now than maybe we're sitting in today. So I would throw that out as well as Jennifer's question. What's resonating? What are you hearing? How do you see yourself in this space? I heard that several times today, and I think that's a key component of this body of work. So I'd love to explore either what's been keeping us or where we see opportunities to better work together.
I think it's been very helpful to hear all the different outreach models happening across the state. I'm really interested in us coordinating. I think I keep coming to this place of applications are great, but what happens after them? And so I think it would be great if, now that we sort of have a better sense of how everyone is operating and the great initiatives that are launched at this point, or launching, how do we also really manage that second piece of figuring out what the barriers really are? Because we know there are so many. We don't necessarily, or at least I don't know, this might be out there. How do we prioritize those? What's the biggest one? Is it the interview? Is it verification? Is it transportation? Does it depend on what county you're in?
Yes.
Yeah. So I think starting to gather some of that information across different outreach initiatives could be useful to help direct this work group's effort. That's sort of what I'm mulling over right now.
I think to tag on to Anya's points, at which I totally agree with, it would be nice too to have some common measurements so that we know which interventions are most effective with which groups, and then have some common understanding about who's owning what, because I think that's also complicated. But if we have measurements about the effectiveness of the different models, and that includes satisfaction by people trying to access benefits, I think that would be really helpful, and I think that's what we need across all of our interventions is how are things improving food security, diet quality, satisfaction, and make sure we're all working against something to answer then the question, to better answer the question.
I think from my observation, having more of the counties at the table is going to be significant, because I've definitely realized that my position, there's certain things, there's a lot we can do, but there's a lot we can't do to convince the counties that we do know best practices, that we have some good guidance. I think additional work, and maybe it comes from Michelle and Todd from their county perspective, talking to more counties to get them more involved. Definitely Denver and Mesa are some of our better partners, but we have a lot of other large counties that have significant impact on our clients that maybe aren't they're not as involved or advanced.
I think that's a really good point, Terry. Michelle, what's your sense about sort of counties? So I know the county human services director, they've they support the blueprint, but when we start getting into action items and really kind of digging into sort of barriers and process improvement between community partners and counties, what would your advice be? And also, is it Maureen? You know, Kathy Smith was on our steering committee as well, and Laramie County as well. What are your suggestions for that piece of the puzzle?
On how to get buy-in, or what do you mean?
Actually, to be at the table as a thought partner around, you know, how can we work in a better and more improved way on behalf of clients to close that gap between the application submission and the application completion and approval by the county. So for instance, like in California, there's a way that all the outreach partners provide feedback from the people that they provide application assistance via listserv, and it's rolled up into themes. And then they actually, in their certain areas, they meet with the counties and say, hey, this is what we're seeing. You know, we don't necessarily have that much bandwidth or capacity, even as outreach partners, to have those types of conversations yet. But I'm wondering if there are ways that we could bring more counties along, really come up with solutions that are going to work for everybody.
Yeah. You know, I think I'm a little bit spoiled here in Mesa County because we have a long-standing history of strong collaboration between the government entities and the community-based organizations, and that type of open communication flows really naturally here, and people trust each other. But I think if there's like mechanisms set up for communication so feedback can go up and down, I think that's very valuable. The people who are on the ground meeting with these individuals are going to have the best feedback in order to improve those systems. And I think, you know, at the county level, at all levels, that's important information to have. Gosh, I don't know, am I headed even in the right direction here?
Yeah, I think that you are. I mean, we might be able to talk more offline, but I do think, one, it would probably be saying, like, what would be the best information to improve? Like, if we were wanting counties to, you know, a different type of partnership, what are what's the there that we want to talk about? And then how might we do that? And how do we actually aggregate the conversation so that it's solution focused and it's based on sort of real experience? So is that kind of what you're talking about? Like, how could we get what we know to be happening and get that to the right players who do want to collaborate and use that information to better the system, right?
Right. I think together a set of best practices. I mean, the flip side to the challenge of having 64 counties is that there's also some really interesting innovation that happens that I don't know if it really gets lifted up as much as it could. So I think that could also be, I think that's an opportunity to fill in. Like if we learn of a really great practice, you know, say extended office hours or a texting program that's really working. I mean, part of not reinventing the wheel 64 times is making sure that we have a good way of communicating that between ourselves as outreach partners, but more importantly, between counties.
Yeah.
So do you guys share best practices? I mean, I know like sometimes, like with Medicaid we did, and I know with the work support strategies, there was a lot more sharing. Are folks at the counties like sharing, you know, I know HS Connects is probably online with a great deal of the state, you know, so what's happening where people are, or is there anything happening in the way that we've seen it in the past?
I don't think there's anything happening like in any real formal structured way. I mean, I know best practice information is shared, but it's usually just between, you know, 1, 2, maybe 3 counties, and it just is something that happened to come up in a conversation. It's not any like organized formal way that all 64 counties would have access to. I mean, I think it would be nice if we had one place where, let's say our community partners identify transportation as an issue, that somewhere I could go and see what are some of the best practices that other counties have used in order to address transportation issues. And there's not going to be a one-size-fits-all answer for all 64 counties on any issue, I don't believe. But I could, maybe somewhere I can go to say, oh, you know what, Larimer County tried this and it worked for them. We're a similar sized county. We have similar size or similar infrastructure issues, and this might work for us. But maybe Aspen and Pitkin County, it might not be the same. But somewhere I can go to see what others have done that has been successful, I think that would be nice.
So, Michelle, like one of the things that these work groups can do is kind of put forward recommendations for prioritization. If we were to sort of make a recommendation, I mean, we've got a couple already kind of in the hopper, at least kind of through some conversation. Would we take that recommendation to SubPAC or CHSDA or?
I would say CHSDA.
That's the County Human Services Directors Association.
I just wanted to add another wrinkle to this discussion, which is that I agree with everything that's been said about trying to increase applications and particularly successful applications, but we've spent very little time talking about the reasons why people get kicked off of SNAP, other than the fact that they're over income. You know, is it a particular form, a recertification form that trips people up? Is it the work requirements? And one thing that would be really interesting for me to know, maybe our state partners could help with this, is if we had any data about the closing codes for when a case gets closed that we could present to this group, so we can see not just the barriers to enrollment, but the barriers to staying on SNAP.
Yeah. Can you describe what you mean by the closing?
So when someone is booted off SNAP and their case is closed in CBMS, I believe there's a code that's associated with the reason why their case has been terminated.
Okay.
Yeah, we have to inform them correctly via their notice why they were not eligible. Did they fail to provide something? Did they fail to recertify? Are they now, not meeting work requirements? Are they now over income?
And so if we had that data for the whole state, but even better broken down by counties, so we could see if like in one particular county is the income verification that's tripping people up or whatever it might be.
No, I agree, and I think adding churn to that by county and in your ME and program reviews, whether or not, like what counties you're seeing over verification.
Yeah, I think it would behoove us to define all of these very clearly as to what do we mean by churn, what time frame churn. When we're looking at denial reasons or closure reasons, are we looking at people who are denied and then the next day they call and they're they cooperate before they're actually closed. Like there's some nuances, especially if we're going to be pulling some reports that I think we can be a little thoughtful on before we jump out there and pull data that maybe we don't understand what we actually have.
I mean, I trust your judgment about what data would be helpful. I just
Well, everybody defines churn a little bit differently because there's different time frames to churn. So in churn specifically, I think we need to make sure we all agree what definition we're using.
Right. I'm just thinking about the closing codes. If we had that data, I think that would be a good starting point.
Well, how accurate do you think the CBMS codes are? That's the problem, Jack, is that the codes aren't correct.
Right. I mean, that's the best we have.
Yes, we have.
Right. Michelle, do you do any of that internally? Do you look at closure codes and churn and over verification at the county level?
We have in the past. We're not currently doing that. What I've seen a lot of is cases that are just closing because they failed to recertify. And, we don't have any information on what caused that to happen. Was it because they got a job? Was it because they got sick? Was it because they died? Was it because it wasn't worth their trouble anymore? There's that huge, huge population that we don't really know why they went off. And, the recidivism or churn, some people will come back a month later, some will come back 3 months later. So that would be something that we would want to define as a group. Who are we looking at?
So if it's 30 days, do you just rescind and reopen, or do you do, okay. Yeah, so probably 60, 90. So I hear a couple of things. One, Michelle echoed, and I think other people echoed, and I think it came through in all of the presentations that we've heard today and then last week, is messaging and marketing and destigmatization. And that's really, the Workgroup 1 is taking the charge on the recommendations. What I've heard today, both from, Michelle is kind of on the fly doing this amazing training, and Brett was talking about, you know, trying to train and do startup across the state. And some of the things I've heard as I have talked with different partners is really trying to come up with easy, kind of standardized ways to train different people in the sector. And I think Sandy's talked about that as well. So there are some themes that are happening, and I think as a group we can kind of try to prioritize those in the next. So what we've done with a few groups is we've tried to prioritize some things that we could work on and bring forward and elevate to the governing council. Like, in order to get 230,000 people enrolled, do we want to put together an action plan about and put a cost to that? Do we want to elevate, you know, training and standardized tools as a recommendation? County community partnerships around what people are seeing on the ground and how might that look in a structure. So I really want the group to kind of think, you know, and talk over the next few minutes and see, like, what are the priorities? I can't imagine I listed all of them, but when we look at the blueprint of the syllabus, there's some pretty high level things, and we can choose a few in the near term that a smaller group of us could work on and elevate up so we get some movement on it.
My perspective is we need to, if we want to hit that number, we need to be concentrated on things at scale. So that's what I talked about, you know, empowering other organizations.
Yep.
We're trying to hit 7,000, that's great.
Yep.
Not going to hit that number.
Right. Yeah.
So that is our soul.
Yeah. And I think I think you're absolutely right. And it's going to take different models for different sectors to participate in it. Some that can integrate it into their current scope of work because they're naturally supporting people, and then like actually paid on the ground application assisters, right? Like, and then scaling the models that we know work.
I think when we talk about scale also, I mean, we can do as much application assistance as possible. We're not going to reach that number. What we see across the state is that communities with high enrollment have good word of mouth. It's like, so I think in improving word of mouth and like destigmatizing in communities will be an important sort of dual strategy with outreach, and a lot of that will depend on improving client experience.
Can you, like, so we have limited input, right, from limited counties that are doing this and communities. When you say word of mouth and you're saying some communities do it better than others, can you give me an example? Like, I mean, we know Pueblo is great, but is that because it's word of mouth or because they've been doing great for 2 decades? But so what do you see that, like, can you describe that?
Yeah, well, so I think, you know, enrollment tends to be highest in those counties around Pueblo. And from what I'm not on the ground there, I'm by no means an expert in what's happening, but from what I've heard, a lot of that comes from the fact that people talk to each other. A lot more people are enrolled in those communities. It's a higher percent of the population that's enrolled in those communities. And so there's like probably a destigmatizing effect there, but also you just hear about it from your friends and neighbors. And that's always going to be more powerful than getting a cold call from me.
Yeah.
But I also think that you can improve word of mouth even where it might not have as dense populations who would access SNAP by making sure that people's experience with the program is really positive. You know, I had conversations when I was on the hotline with people who are like, I did that 10 years ago, I got an overpayment, I am not touching that program.
Yeah.
You know what I mean? And so I think that there's a lot of work to kind of undo harm that the program has done. And one thing we can do to just, like, from this point forward, let's try to reduce that going forward, you know, make sure that doesn't happen. But then, yeah, I just think that if we really are looking at that number, our organizations aren't going to be able to do as much as like infiltrating community messaging.
Yeah.
Yeah.
I'd love to share with you maybe, well, I can share a little bit. So one of the things, there are 2 work group 1 recommendations going forward. One is on a broad statewide public and political will building public education campaign to, again, like when we're looking at a state where we have 1 in 7 kids hungry, that's a normal, it's a normal part of our everyday life. So how do we educate the entire, state and begin to drive, this conversation about hunger and the solutions? And then the second recommendation is, sort of life-affirming, positive, messaging and marketing for SNAP and WIC. And so those two things are moving forward, because I agree. I mean, if these conversations aren't we have repair work to do, right? And we have this public awareness issue, and then people don't know how prevalent it is.
So I think one of the things to think about across all the different work groups is that because these are related issues and they do support one another, when we're thinking about setting goals and how are we going to get to 230,000, we have to set a goal that says, how much do we think the improvements in public awareness and all of those efforts, well, how many would that generate? Would that generate 50,000? How many do we think? And we're not going to be right. We're going to throw a number out there and we're going to guess. But, I think it's a number that we would also need to figure out how do we measure it. BDT was part of, is still a part of an effort in New York City that was led by the Robin Hood Foundation. And they set out a goal. Initially, they wanted it to be 2 years, and they've now extended it to 3 years, where they wanted to cut the participation gap in half. So they set out to enroll 140,000 individuals in that 2-year, now 3-year period. And so, as being a part of that group, we had to come up with some estimates of what were we going to be able to get through various pieces. And one of the pieces was the innovations that the city agency was doing. For example, they did deploy during that time frame an on-demand interview that started with recertification and then moved to the actual application assistance. And they had to be, we had to factor in those assumptions as well. So I think one of the challenges we have is thinking about all of the pieces and trying to assign and estimate what might be done there. So there might be a county that has a new innovation they're launching, and maybe that's going to help them reach another 2,000 people. There has to be a way for us to be able to compile that effort.
Definitely, and I think what's interesting here is, counties, I think counties are really willing to participate in the part of that's their job, right, which is to process the application, but they don't have the capacity or the funding to do the outreach and enrollment. I think Michelle spoke to that. How do we, if they can, incrementally drive the traffic and absorb it with best practices, we still have to get the community to drive the applications there. So I'm wondering how they can affix your factors in.
Yeah, I think. I was just going to say, I think that's totally right.
I had a question. So to Anya's point about it's better if your friend calls you and then encourages you to sign up than a professional outreach person. So if I order Domino's Pizza, it says I get $7 off my next order if I refer a friend to Domino's Pizza. Has there ever been a state where clients can get a SNAP bonus if they make a successful referral? Whatever it might be, that they can get $10 extra, $10 in county funds in the next month if they refer the person?
I don't think so. There's no funding stream for it, and it's a scale we're looking at.
Well, I mean, if you think about the funding for outreach partners through,
you can't use that money for that. You can't use SNAP outreach dollars to provide incentives to other clients to refer people.
But I mean, we have other funding incentives, say incentives like the Double Up Box, where we use state dollars to encourage healthy diet options. Is this something that anyone's ever heard of being tried before? A referral bonus system?
Yeah, it would have to be non-federal money. Federal level, but that doesn't mean there's not private funds out there.
I think also that from an outreach perspective, it sounds like if you don't have to look at the giant number, but if you got to a certain point in different counties, then maybe there's a word of mouth breaking point. Figuring out what that is.
And I agree about, like, once you start talking about it, is this cross-systems piece too. So then we have allies at HICPOS, and we have allies at hospitals and health centers, and WIC and summer meal programs, and that drives community awareness, that then drives word of mouth about other programs. And so I think it's exponential. It's just, I agree, like with the Robin Hood, I'd love to see what their plan was. I don't know if it's public, but.
Well, I think the plan was too expensive.
I see, yeah.
It was a very grassroots plan that
Mhm.
could not be funded.
Okay, so they're not gonna make it.
I don't think so.
Yeah. Never mind.
Go ahead.
Two quick points. I think the public will building can't be separate from the tools to do it. So I think the two need to be really built together as much as possible, or informed by one another. And the second is, I think the lowest hanging fruit obviously is our Medicaid beneficiaries that are unenrolled. So understanding what are all the opportunities at recertification, at enrollment, to talk about each other's programs. So we should never be talking about SNAP alone, Medicaid alone, or WIC alone. How do we bundle it? And how do we better develop a system to better enroll in all those systems quickly? And same with recertification. How do we make sure at recertification that we work together to enroll people in all of those benefits?
Yeah, I mean, the good thing, well, like, good reality, sad reality is we've got 95% Medicaid penetration rate, but that's why we need to focus on the food program enrollment. And then.
Not at but that's why recertification is such a huge opportunity.
Oh, yeah, I mean,
for
HICPOS should
Medicaid.
be talking to, at the 12 months recert, they should be talking with their Health First beneficiaries about these programs. And did you guys do a pilot? Someone just did a pilot where if you contact a Medicaid recipient within 10 days of applying, there's a much higher likelihood, like a really crazy high number, that they will enroll in SNAP. I just read it. Did I send it to I had to have sent it to somebody. Might have been you. Okay, yeah. So, I mean, so that's another strategy is getting to those families while they're still kind of in the mindset of eligibility determination, right? So they know they just enrolled and interfaced with either the PEAK system or, something, and then they're more likely to respond. I don't remember who did that pilot, but it was interesting.
Well, we have about 2 minutes left, so I'm going to call time, given our timing. Any other last thoughts for the benefit of the group before we wrap up today?
May or may not be helpful, but it strikes me as a great group to take a collective impact model on. I don't know if folks are familiar with that, but essentially shared agenda, shared measurement, things you were talking about. We each do our own thing, but towards that end goal, maybe we're doing that, I don't know, but.
We're trying to do that coordination. I think collective impact is like people have PTSD in the room from that. But no, certainly I think that's what the blueprint's about, is building on the best of what's happening with this common sort of vision around, this work group and Workgroup 5 have the easiest to quantify measurements of success. And I agree, I think we don't want to see duplication. We want to see building on each other's strengths, using shared technology when we can, so air traffic control, certainly. And then prioritizing, the ultimate goal, which is hundreds of thousands of people on SNAP in the next 5 years, and WIC.
Well, if the word gives people PTSD, that's okay, but
yeah.
It feels to me like the concepts, the core concepts are important. It's shared measurement, shared agenda, all that.
We were trying to also coordinate with Courtney at the beginning of the work groups, but I guess she's not with Trailhead anymore.
Coming into
Okay, and she was going to work on getting all of the performance measurements and what our work is and where it's happening and where the impact is, to kind of reduce that duplication of effort so we can kind of all see where the landscape is. And I don't know where that fell off to once she left, so I know that was something that she was talking about, trying to coordinate.
Well, I can probably, I mean, I can take the mantle on some of that. I can ask either you guys to send me your reports from last federal fiscal year for your outreach, or I can get them from the state and map out, and then map like what your future goals are, and then the avenues by which you work. I'm pretty familiar with all of them, not so much benefits in action, but Karen Scher will be presenting next month.
And it was also like the geographies, like actually physically where is the impact happening.
Right, and I can tell you right now, there's not that many, I mean, there's only 4 or 5 fully funded FTE to do SNAP outreach in the community across the state. You know, you guys have a couple. Karen Scher has 1.5, and then you've got somebody in Mesa, right, or something in Western Slope. So that's it. You know, that's the only fully funded FTE on the ground. So I think that's one of the, you know, I think it is important to look at that. I just spoke with the Family Resource Centers directors last week, and I think there is a lot of interest in these groups coming up and being funded outreach partners if we can get the training in place, get the marketing in place, and get some funding in place. But right now, you know, there's just not a lot to map, unfortunately.
Yeah, sorry that dropped off our radar. We can follow up with you and try and get that together.
Okay, so it's 3 o'clock. Thank you all for your participation. Good to see everybody.